symptoms that we normally see when the dentist is going to recommend a night guard is any source of clenching or grinding. So clenching and grinding comes with stressors in our life, and normally patients tense up at nighttime and are clenching their teeth, adding extra forces to the teeth. And so the symptoms we normally see is you can notice a wear pattern, very worn down teeth. You can notice that patients are complaining about headaches when they wake up and things like that. And so that's usually when a night guard is recommended. The night guard's made at the dental office. We do take scans or impressions of the patient's mouth and custom fit night guard to that.